During the next section, and we have to see if there are any questions. We remind you to please send in your questions. Okay. We will bring them in. So let us continue on, and later on, we will be able to try to respond these questions. Very well, then the next block has to do with technical capabilities for emergency response. In a very short time period, we will have to be discussing topics which are tremendously important, but just we have to emphasize points of interest regarding many of the things you have already stated. You have Dr. Alex Camacho, Regional Advisor in the PAHO Disaster Office, who will be giving us an analysis regarding a very useful tool that has already been proven in the past. Go ahead, Alex, you have the floor. Thank you so very much. Thank you for this invitation. My congratulations to all the previous panelists who have given us extremely valuable information. I will be sharing my screen with you at this point in time in order to discuss a tool which, together with a group of colleagues, Dr. Hernandez, basically, we have been able to develop for, and we have continued to improve it, by the way, for some time now, in order to collaborate so as to try to have a key information diagnosis for decision-making purposes after any given event. We're thinking of resilient hospitals, not just hospitals, but also other healthcare networks, so that they may be sustainable and inclusive. One of the main actors that many of our colleagues have mentioned, and one of the main elements is to be able to recover and to reestablish care and the delivery of services as soon as possible. One of the aspects which indeed contribute toward this approach, so that all hospitals may be able to resist the situation, be able to assimilate any given impact, and to adapt in keeping with their responsibilities and whatever has been caused by any given event, with three basic elements: to ensure the operation and protect the investment, of course. So this is what we have developed together with Leonardo and members of his team, which is one more piece in this process, which lead toward the reduction of the risk in order to reduce losses, protecting investment, and guaranteeing the pursuit of the exercise. There's a whole series of tools which have been dealt with in all the cycles of risk: hospital network, assessment of risk for hospitals, and the key point for this response has to do with the command system of incidents in the hospital, without leaving aside other instruments and tools. And here's where the so-called ERES comes in, ERES. This is the name of this tool that I will be describing to you momentarily, and which is a key element of this puzzle in order to be able to advance in the reduction of problems, early recovery, as well as the expansion of capabilities, and of course the necessary possible evacuation. It was given the name ERES, which is the rapid evaluation of healthcare establishment in Spanish, as a process for assess the actual needs, to identify priority needs, and foremost, to understand clearly what is the supply of such services, to be able to give support to the rapid recovery of the establishments. It is a tool that enables us to have a rapid diagnosis of the health care establishments of the state affected by an adverse event, to learn about the actual damage that will enable us to make rapid decisions, and in view of the operation, see whether that establishment can continue to provide medical care or not. Among these, which are the main problems that would call for additional evaluation, and which services are still available. It is not a structural evaluation. Identify damages visually for decision-making during the early hours of an event, and then to request a structural evaluation, specialized evaluation otherwise, and be able to make decisions as to what is the situation of patients and others. The scope and reach of this tool has been suggested to take place during the first 72 hours by those responsible for management of these emergencies in healthcare establishments, as well as response teams and emergency services. Thus, to be able to collect concrete and vital information, as I was saying, in a very rapid way, so that we can identify the most important necessary interventions that will enable us to reestablish the operation of such elements. This could greatly contribute to help when there is a lack of healthcare services, something which happens oftentimes in the case of a disaster. This is the structure of this ERES works after the response itself, to promote an immediate recovery, a very rapid tool that has been developed and which is part of an entire system to make it available to all the countries. Has already been used in several emergencies. Honduras, one of the instances, and used in Haiti. It has been used repeatedly in Mexico, and it is a multi-language tool. It is now available in English, Spanish, French, Creole, and, well, Haitian Creole, of course, in French. So it has here an item that allows us to go step by step with these tags, where we can input the general information of whatever establishment, and very important and rapid information that will allow us to know what is the location, what are the elements and the hospital capability existing, to see what is the possible supply of services that that establishment can provide after the event, and what the emergency committee can do. There's a incident command team, and what are the communication and transportation facilities existing. Amongst this, we have also information which is important, access to water, electricity, etc. Whether what has been affected, what is working and what is not.
And then the integrity of the evaluation of the facility, because it may consider or need a specialized visit to determine whether the structure is functioning or not. This tool has been thought of from a perspective of multi-threat, but it was used during the pandemic, and also not just during the pandemic, but it was also used when the establishments had to deal with other events. We also have information on the number of beds available, the state assessment of the essential and auxiliary services in terms of staff, financing, resources, teams, and services provided. But it's also important to have include the establishments who are part of the network, who are available and operational to be able to make decisions in that regard. What's important that is immediately after you fill in this form, which takes no more than 10 to 15 minutes to fill it out, we have information on the integrity of the establishment, the basic functions, and a general summary of the services and auxiliary services provide. And a fairly executive report is generated, which can allow you to make decisions and even alert the institutions that could be alerted within 72 hours. Of course, as more time goes by, there is a greater use for this, I think. Thank you very much, Leonardo. Alex, thank you for the presentation. As always, very timely, and I thank you very much for this presentation.